Welcome back. The Volta Regional Health Directorate of the Ghana Health Service says it is putting in place measures to avert the recurrence of deaths resulting from food poisoning in Akakpokofe. 6 people have so far been confirmed dead after they ate the popular banku and okra soup. JoyNews' Maxwell Agbagba was in the Sogakope and has been interacting with some affected families.
You have our condolence. Okay, we say rest in peace to all of them. Take heart.
Hey, people help me.
Take heart. No, don't fall. No, wait.
People help me. No, help me.
Can somebody wait? No, wait. No, wait.
Okay.
Yeah. Okay, so this is the situation we have here at Akakpokofe. It's all wailing here in this community. The man you just saw behind me, these are his 2 children, his 2 daughters. Their family actually bought the corn flour, the corn mill operator. So these are the 2 children. They are dead now. And then, okay, so this is this woman, I'm told, is the grandmother, and then this is the mother of the 2 children. She also died, so 3 of them dead, plus the family of the corn mill operator, the wife of the corn mill operator, and then his 2 children, all making 6. Another man, the corn mill operator himself, we are told, is currently at the Sogakope District Hospital. Another girl who also ate the food, she is fine right now, and we're told she's at the Sogakope District Hospital. Now, we'll be interacting with a lot more people in this community. We'll be bringing you more details here.
I don't personally have the words to describe what is just happening in that video there, but Maxwell Agbagba, who's been on the ground, he's here in the studio. Maxwell, you're welcome.
Thank you very much.
How are you doing?
I don't know what I'm doing well because it's been a traumatizing experience.
I know, right? You'll be fine. You'll be fine. How do they have any explanation as to how eating the condo that we've all eaten all of our lives all of a sudden begins to kill people? Are there any explanations?
Well, they're unable to give explanations right now. So that has actually compelled them to sort of stop cooking in that community because banku, or I probably don't want to call it, is a staple food, just as we know in a lot of other communities. That is what they eat all the time. And ever since this incident happened, lots of the residents there have actually...
Ever since? When was this, please? When did this happen?
They started recording the deaths on Friday. So the first death occurred on Friday, and then Saturday, and then Sunday, and then Monday. So it has been back to back. So when the first person died, they thought, oh, the rest are going to be fine. But then it didn't end there. On Saturday, they recorded another death. On Sunday, whilst we were there, they recorded another death. And then today, Monday, they recorded, today, they also recorded 2 deaths. Yesterday, when we were there entirely, I mean, it was getting late, but the people were not cooking. Today, also, we observed that we realized that nobody in the community was cooking. Not that they were told not to cook, but on their own.
To understand, how does it happen? So they ate on Friday. Yeah. And did they tell you exactly what happened before those persons died?
So this is what we are learning, that on Friday, the corn mill operator prepared the corn flour from a residue of different corn that was brought to his corn milling shop. Okay. So he prepared the corn flour from that, different types of corn.
So different people brought their corn to be milled, and then
the residue of that corn.
There were bits of it. Now he put it together,
and I hear
prepared it for his family.
Exactly, and I hear it's called 7-7. That is what they call it, there. So what happened?
What does it mean, 7-7?
I'm unable to tell what it means, but that's what they call it. Okay. So the corn mill operator prepared the corn flour out of that, and then sold it to another family. They came to buy from the corn mill operator. So that's the family of the man we saw wailing, earlier. Right. His wife, and then 2 daughters, died after eating that meal prepared from the corn flour. And we are told that they bought the corn flour on Thursday evening. On Friday evening, they started complaining of tummy upset, and then they were also, vomiting and all of that.
Were they taken to the hospital?
Okay, so on Friday, they were not taken to the hospital. We were told on Saturday morning, they were rushed to the hospital. When they were rushed to the hospital, I mean, they couldn't help it. And then, the wife, that man's wife, and then his 2 daughters died at the hospital. And then for the corn mill operator, he also lost his wife, and then 1 son, and then a daughter. So 6 people, 8 in total ate the food. 6 of them dead. The corn mill operator, we're told, is currently at the Akakpokofe district hospital. Now, another girl who's just 8 years, I think it's by miracle that she's still, alive. And
does she complain of the same stomach upset?
Yeah, initially she complained of tummy upset, but she has been stabilized by the doctors, and now she's fine. In fact, yesterday and then today we saw her; she's absolutely fine.
Could it be that if they had reached the hospital on time, perhaps they could have been saved?
Yes, I've been interacting with the medical director for the Akakpokofe District Hospital. He was telling me that if they had reported on time, he said they delayed in reporting to the hospital. So that probably also, worsened their situation. And then there were some talks about the hospital itself sending samples of the corn flour to the Noguchi Memorial Institute on time, so that they'll be able to know exactly what is happening in that community, the kind of treatments they'll give to the victims. But they delayed. And when I asked him, spoke to him, he said there was poor coordination because it was over the weekend, and that was why they couldn't, transfer or send the samples to Accra, on time. We can listen to him. That's the medical director of the Akakpokofe District Hospital, and then the director of public health of the Volta region.
Very well.
And samples have been sent to Noguchi Memorial Institute.
Okay, when
yesterday.
Was sent yesterday. Wouldn't you say that we wasted so much time in sending the samples to Noguchi? Because if you want to treat those patients right now, we still do not know what exactly they consumed from that corn flour. What was in that corn flour, I should say.
Yeah, you are right. We don't actually know exactly what is happening. That is why there's food samples as well as the blood samples were sent to Accra. It's not late. The 8 people who were brought to the hospital, and 6 of them died. The 8 is out of a big community, so they are contained. We are no longer getting more cases from the community. So it's not late. However, we are hoping by noon thereabout we'll get something from Accra.
But don't you think if you had gotten confirmation from Noguchi on what exactly is the cause of death, you would have been able to avert the death of the 2 people who died today?
Yes, no. No, because they started exhibiting symptoms on Wednesday when they ingested the food on Tuesday. They took supper on Tuesday and they started exhibiting symptoms of the suspected food poisoning on Wednesday in the morning. And we saw them on Friday. So already, if it is bacteria or virus, toxins would have already formed in the blood before they presented. So they would have presented with this with preformed toxins. That's what we call poisoning. So it's very difficult. They had not even come with the virus. They came with the poisons from the virus or bacteria, which we don't know for now.
So you're saying that even if you had known the results from Noguchi on what exactly was the cause, it would have still been difficult to prevent the 2 deaths that we recorded?
Probably if they had reported immediately when they started exhibiting symptoms on Wednesday in the morning, probably with the antibiotics and other medications we started could have saved them.
Okay, I'll come back to you, but let me talk to Dr. Yeboah also. Doc, how do you feel about the situation that we have here in the Volta region, Akakpokofe? What is your outfit doing?
No, obviously it's a very, very bad situation, but the Ghana Health Service is doing everything that needs to be done. As soon as we heard this situation, We have rapid response team, which was quickly dispatched to the communities to carry out certain activities which are required in situations like this. So what we need to do, we are doing it. And then, it's a very, very difficult situation. It's very sad at the moment. We've already lost 6 out of the 8. The cases range between age between 7 years and 44 years, and that is, we are talking about 2 females and then 6 males. It's a very, very bad situation, but we've done everything that needs to be done, and we are still in the process. You can see at the moment we are holding the Public Health Emergency Management Committee, and at the same time, soon after that, there will also be the DICEP, which is also being organized by the Honorable District Chief Executive. So, yeah.
Okay, so we were told that officials from the Food and Drugs Authority were in some adjoining communities yesterday because the corn flour that was used, we are told, is a residue of different corn that they put together and then they used in preparation of the corn flour. So we're told they were scouting other areas to see if people still had those, that corn flour in their possession. What did you establish?
Yeah, we work together. They are part of the rapid response team, members of the Food and Drug Authority. So yes, so we went together and then we arranged to get samples of the dough that they prepared the banku from. So that have been taken and it's been sent to their laboratory for further analysis. Having said that, we've also taken blood samples to Noguchi Memorial Institute for Medical Research for further analysis. And it's not like the people were not being treated or not being managed. Far from that. Ideally, yes, we should be able to know exactly what is causing, these illnesses.
But we were not able to tell us at the time that they were there. They were there for like about 3 days. Some of them died. If we had known the cause, don't you think would have found a better way, the solution to their problem? But now we didn't know what was wrong with them, so we're treating them. I'm not a medical expert, but we're treating them,
No, you see, when there's a situation like this, there's a protocol that we follow. Okay. It's standard protocol, and all the necessary protocols are being adhered to. And as I said, it's very unfortunate we've lost so many of the. But having said that, it's unfortunate that they took the food on 27th of February, and the following day, that's 24 hours later, they started having problems with, started having abdominal pains, vomiting, some started vomiting, and then also developed fever as well. But they also didn't turn up at the hospital or reported at the hospital until 3 days later. So these are some of the reasons why, unfortunately, it has become a little bit more difficult to manage them effectively. But what we need to do, we are engaging the community. We are still actively, investigating and then analyzing whatever is available and then what might have caused this suspected poison. So we are not resting on our oars at all. There's a lot to be done. Yes.
When are we likely to get results and know the exact cause of death?
No, this is very urgent. I don't want to put any specific timeline on that, but it's an urgent situation. Just think about it. On Sunday, most laboratories are closed on Sundays, but Noguchi we managed to make the necessary arrangements, and Noguchi officers were kind enough to dispatch officers to collect the samples on Sunday. So a lot is being done.
So when should we expect the results? Are you able to tell us?
No, we are for now. Our focus is on saving the lives of the 2 remaining people on admission, and that's our focus. And at the same time, making sure that other people do not consume, similar food which is already causing this sort of problem.
But finally, before you go broadly, what are you also going to do to ensure, that people are safe? Because this is corn flour that was used in preparing a meal.
Yeah,
what mechanisms have you put in place right now?
Education is very important. As I speak to you now, we have engaged the communities. We are talking to them, and you recall that a couple of months ago we did have some problems at Bando and then Hohoi with respect to some poison of fish, which was also consumed. We need to continue. We need to persist with our education of the public. And all of you are doing a marvelous job in that respect, and we are appealing to all. Health is not just about health workers; it's about all.
Maxwell Agbogba, the engaging health officials in Akakpokofe, is this situated in the town, or this is in Angoga itself?
Okay, no, this
Sugakope.
Yeah, it's about 10 minutes drive from Sugakope.
From Sugakope.
Yeah, from Sugakope.
So it must have taken some time for the people to commute. Are the roads there good?
The roads there are perfect.
Right.
I mean, the highway there is perfect. There are no problems with the highway.
So it shouldn't take them so long to reach the hospital.
It shouldn't take them so long to reach the hospital. From Akakpokofe to Sugakope district hospital should be like 5 minutes drive or 7 minutes drive. It's not far.
It still remains to be seen what exactly is contaminated or has contaminated the food that they ate.
Yeah, I've been speaking to a lot of the residents, and for the head of family for the corn mill operator, he says he's keeping an open mind right now, waiting for the results from the Noguchi Memorial Institute. But he also suspects that, I mean, there's a possibility that somebody deliberately poisoned the corn flour.
This is the family speaking?
Yeah, this is the family speaking. Geshen Gamo, he's the head of family for the corn mill operator. And he's saying that if that is established, that yes, somebody deliberately poisoned the corn flour, he's going to consult the gods. He said he would allow the law to take its course, but first of all, they would also have to allow the traditional law to take its course. Yeah.
At the time you were leaving, what was happening?
Well, the town has virtually come to a standstill. On a normal day, I'm told that when you come to the village around 12 a.m., you wouldn't find people in their homes. All of them would be on the farms. The children in the community also would be in school. And when we went there, all the community people were gathered in the homes of the two deceased. The people who died. All of
you
them
need to get a bit of throat clearing there.
All of them, were gathered there in mourning clothes. They didn't go to the farm. All the school children, all the children there also did not go to school today. And they were gathered on a tree, just mourning. Scores of them gathered, discussing the issue, because they say that, I mean, looking at what has happened, it could have been
anything, anything that they ate, or any of them. They mean
it could have been any of them, because when the Food and Drugs Authority people came around, some people still had the flour in their rooms.
Exactly. So I was going to find out. I was going to find out what is the plan to. How do they even know? Are they able to identify that this is the particular corn flour that we ate? That's causing this problem?
Yes, they are able to tell. Now, a woman that I spoke to, she lost her daughter and then granddaughter. She told me that she has actually hidden, the rest of the corn flour in a room and is waiting for the FDA, to come, and then she'll present it to them so that they go and test it. Okay. That was yesterday. So they all know that this is the flour that we ate, and that is what is causing the problem.
But you bring us a lot more on this on JoyNews Prime. Tell us what to expect, Agbogba.
Well, we will be bringing you details of the conversation that we had with the head of family. We'll also be bringing you an interaction with the daughter of the woman who passed away together with the two daughters. So this girl has lost her mom and then her two sisters.
Wow.
Yes, and then we'll be talking to the aunt as well. Okay. A lot more will be coming up in JoyNews.
Maxwell, thank you very much, and do get well from that traumatizing experience. We do feel it too when we have to report on some of these stories, and our heart goes out to the people of Akakpokofe. We wish you all the very best as we work to find out what exactly is the problem here.